Hello everyone, myself Himani Sharma from RPIIT campus. In today's class, I discuss about understanding the stroke and causes, symptoms, and prevention. A stroke is a medical emergency that occurs when blood flow to the brain is interrupted, and understanding its cause, symptoms, and prevention crucial for reducing its impact. This presentation will explore these aspects to empower the individuals with the knowledge about the stroke. And what is a stroke? A stroke occurs when there is a disruption in a blood supply to brain, leading to the death of the brain cells. And there are the two main types: ischemic caused by the blockage and hemorrhagic caused by the bleeding. Recognizing these types of vital effective treatment. Causes of the ischemic stroke. Ischemic stroke are the primarily caused by the blood clots, and that block arteries supplies blood to the brain. Common risk factors including high blood pressure, diabetes, and high cholesterol. Lifestyle choices such as the smoking and poor diet also contribute significantly to these risks. Hemorrhagic stroke occur when a blood vessel in the brain ruptures. Common causes include the aneurysm, arteriovenous malformations, and hypertension. Understanding these causes can help in identifying individual at risk and implementing the preventive measures. Recognizing the symptoms of a stroke is crucial for promote the treatment. Common symptoms include the sudden numbness, confusions, trouble speaking, and severe headache. The acronym fast face arm speech time is a helpful tool of identifying the stroke sign and quickly. Risk factor overview. Several risk factors contribute to stroke, including age, family history, and lifestyle choices. Conditions such as the arterial fibrillation and obesity also increase the likelihood of the experiencing a stroke. Awareness of these factors is essential for prevention. Preventing stroke. Preventing stroke involves the managing risk factors, lifestyle changes, regular exercise, and a balanced diet, and avoiding the smoking can significantly reduce the risk. Additionally, regular health checkups can help the monitor conditions like high blood pressures and diabetes. A healthy diet play a crucial role in the stroke prevention. Consuming the plenty of the fruit, vegetables, and whole grains while limiting saturated fats and the sodium can help them maintain a healthy blood pressure and cholesterol level, reducing the stroke risk. Importance of the exercise. Regular physical activity strengthen the heart and improve the blood circulation, which can help the lower the risk of the stroke. Aim for at least 150 minutes of the moderate exercise each week. Simple activity like walking and swimming can be very beneficial. When to seek help if you are or the someone else experience symptoms of a stroke, it is crucial to seek emergency medical help immediately. Time is of the essence. Is faster treatment is recovered, the better the chances of recovery and minimizing the damage. Conclusion. Understanding the causes, symptoms, and the prevention of stroke essential for everyone. By recognizing risk factor and making them significantly reduce the likelihood of experiencing a stroke. Stay informed and